First off, I want to thank the brave men and women who work behind the wall. I want to thank them on a national level because their job goes unrecognized.
How do they try to turn a guard?
Well, correctional officer. Sorry, I apologize. But correctional officer.
All right, guys, how you doing? Another episode from Terror Talk. Guys, last week we did frequently asked questions for correctional officers about COVID-19. Well, now we have part 2, COVID-19 frequently asked questions for correctional officers. They answer some commonly asked questions about COVID-19 transmission and testing. Again, this is by Marion Myers. A quick disclaimer, there's still much we don't know about COVID-19, and unfortunately that means some answers may be our best guess based on current information and data available. These frequently asked questions were developed based on our current understanding of the virus and may change over time. Now, guys, you can find this article on Corrections 1, or you can find it right on my Terror Talk Facebook page. So, COVID-19 testing. At what point during the incubation period will testing show positive? A recent study showed that the average incubation period is about 5 days, while about 97% of patients will show symptoms within 12 days. This is why the Center for Disease Control recommends self-isolation for 14 days following exposure. Regarding testing positive, it really depends on the individual. Some will test positive with little or no symptoms, but the majority will be symptomatic when they test positive. What is the turnaround time for COVID-19 test samples to come back either positive or negative? Well, it depends on the hospital or the group performing the test. Tests can take anywhere from 48 hours to a week for the results to return. More rapid tests are currently being developed. Can you show symptoms and test negative, but then test positive a few days later? If you're showing symptoms, that means that the virus has replicated enough to be detected by the test. Therefore, if you have symptoms but test negative, your symptoms are most likely not due to COVID-19, although no test is 100% perfect. It's possible that when you are asymptomatic, you may test negative early in an infection and then positive later once the virus has had the opportunity to replicate and grow. If someone had the exact symptoms 6 weeks ago and recovered 4 weeks ago, would they have a positive result if tested now if it was COVID-19 then? If they have fully recovered, then they should test negative since the virus is no longer present or replicating in their body because there's current tests look for virus particles. There are some reports of individuals getting reinfected, but this seems to be rare. Blood tests are being developed to test if you were once infected and now immune, but are not available yet. Personal protective equipment, PPE. We're hearing conflicting reports. Some say the masks don't help you from getting the virus, but then we see medical personnel with masks. Do they help or diminish a person's chance of contracting the coronavirus? Per CDC guidelines, face masks should be worn by those who are sick, those caring for sick individuals, and those interacting with people who are sick. Face masks may be in short supply. Therefore, priority should be given to caregivers. And in general, individuals should only wear masks when they're in close, prolonged contact with COVID-19 or potential COVID-19 patients. Face masks do protect you from respiratory droplets that transmit the disease. We're being told by our medical professional that surgical masks are acceptable if an N95 mask is not available. Can that be confirmed? COVID-19 is mainly spread by coughing, sneezing, and other fluids, droplets, which a surgical mask will protect against. There are some cases when an N95 mask should be used, such as airway management, because there's a potential for virus aerolization. For those who are not performing airway management, surgical mask and proper hand washing are sufficient for their protection based on the type of task they will be performing. Can N95 masks be reused multiple times to conserve resources? The World Health Organization, WHO, and CDC are currently not recommending reusing masks. However, in hospitals where supplies are in critically short supply, attempts at cleaning the mask and reusing may occur against standard advice. The CDC currently has a burn rate calculator that can help you determine how quickly you're using your PPE. There is constant talk about proper fit testing for N95 masks. Many large departments are trying to catch up to the spread of the disease, but there's a concern about giving out equipment without the proper fit. How necessary is it to be fit tested for the N95 mask, and will the mask still be operable without a fit test? It's important to ensure that the N95 masks are fitted correctly to the wearer. If they are not fitted correctly, the user is at risk for exposure despite wearing the mask. Training is important to ensure that masks are being used correctly, otherwise they may not be providing adequate protection. In addition, facial hair may impair proper sealing. COVID-19 transmission. How do you define an exposure? You need to be in close contact with an affected individual in order to get sick. This includes living in the same household, caring for a patient with COVID-19, being in direct contact with secretions from a sick person, coughing, sneezing, etc., being within 6 feet of a sick person for more than 10 minutes, and these situations do not count as an exposure if you are wearing the proper PPE. How is COVID-19 spread? Currently, we believe that COVID-19 is being spread predominantly by respiratory droplets, coughing, sneezing, etc., and by direct contact, touching others or objects that infected individuals have also touched. If you contract COVID-19 and get over it, is it safe to assume you are now immune? If not, are you at risk of reinfecting yourself by handling household goods that you touched while infected? Right now, we believe that once you have been infected and recovered fully, that you are now immune to the virus. There are some reports of reinfection, but it's unlikely that you would get sick again by handling items you had previously handled while sick. If someone is confirmed to have COVID-19, what is the typical length of time before they're no longer contagious? We're still unsure how long patients are contagious, but current belief is that they are most contagious while they're displaying symptoms and can transmit the disease a few days before and after they have symptoms. Data from China suggests asymptomatic people should be isolated for 14 days to ensure they do not develop symptoms. If someone is not showing symptoms and you are in contact with them, but later within the 2 to 14 days exhibit symptoms and test positive, is it possible that you could be infected with the virus as well? Yes, it's possible that you are infected. Therefore, you should self-isolate for 14 days to ensure you don't develop symptoms. If COVID-19 is causing pneumonia, can people take a preventive measure such as getting a pneumonia vaccine to help reduce or mitigate the impact on a patient? Is this something we should consider for first responders? The pneumonia vaccine is designed to protect against bacteria that commonly causes pneumonia. It won't prevent COVID-19 from causing pneumonia, but it may prevent a secondary bacterial infection from occurring. First responders should be up to date on all their vaccinations. When washing hands, should we use antibacterial soap? Regular soap is sufficient. The key is to cover all surfaces and wash for at least 20 seconds. If you are unable to use soap and water, hand sanitizer containing at least 60% alcohol will kill most pathogens. Are the symptoms different from mild illness? The most common symptoms of COVID-19 are fever, tiredness, and a dry cough. That being said, some patients may have aches, nasal congestion, runny nose, sore throats, or diarrhea. More severe symptoms include difficulty breathing or respiratory distress. Do symptoms always include a fever? A recent study from China found that about 90% of COVID-19 patients had a fever. We can assume that the majority will have a fever, but there is still a possibility that some infected patients will not. And the last one, have there been any updates to guidelines regarding pregnant women? Pregnant women are susceptible as well, but do not appear to be at an increased risk. They should practice social distancing and wear appropriate PPE. Currently, we don't believe the virus can cross the placenta to the baby because of cases we have seen in China. Hey guys, just more information. Just want to keep you in the know. If we have concerns, I want to keep those concerns realistic. And just like I don't want us to be afraid on what can be sensationalized by the news, this is the balance that we can create. The more information, the more education, the better we can to prepare ourselves and make sure that the resources we use are where it needs to be. As always, guys, the show is Tier Talk. Stay safe.